guys, welcome back. It's Nursekarma. I know you guys have probably been wondering, where the heck is she? Well, the thing is, I changed units and now I am a labor and delivery nurse and I'm popping babies. Oh yeah. So I wanted to make this video so that you guys could have a clear idea of what it's like to be a labor and delivery nurse for anyone that's considering the possibilities. So many people have the misconception that being a labor nurse, you're just in a labor room with a doctor and delivering a baby. No, there's more to it than that. I got trained to work in 5 different areas, which includes labor room, pre-op, OR, PACU, and antepartum, high-risk maternity. Let me tell you that this is not something that just any med-surg nurse can walk into, okay? Because it's a whole new world. I had some Aladdin vibes there, sorry. My favorite part is working in the labor room. I love it because I'm in charge of everything that goes on in there. I'm making sure that I'm getting consents, I'm starting IVs, I'm starting fluids, I'm getting orders from the physician. It's a lot of communication back and forth. For the most part, I do the vaginal exams. I update the physician on the progress of labor. I assist the CRNAs and anesthesiologists with doing the epidurals. I'm there continuously monitoring the fetal heart tones and mom's vital signs, and I'm basically just the coach throughout this whole process, reassuring moms that everything's gonna be okay and you can do this, you can do this. Then we have pre-op. In pre-op, you're in charge of making sure that the doctor signs all their consents as well as the patient. You're in charge of starting an IV, hanging fluids, putting SCDs on, hanging the antibiotics for the anesthesia to administer in the OR, and overall just easing the patient's anxiety. You have to do the admission of the patient as well. You have to do risk factors. So there's a lot of paperwork and actions that go into pre-op. It's a pretty busy area, I have to say. So in the OR, things can run either really smoothly or it can be utter and complete chaos. There are 2 roles that you can have as a labor nurse in the OR. So you can either be baby nurse, which you're in charge of making sure that all the safety equipment has been checked, that everything is ready for once the baby is delivered. You're in charge of giving report to the neonatologist. And you can also be the circulator, which you're just in charge of everything that goes on in the OR. And you're the boss and you're running the show. You're making sure that everybody does their job correctly. So you're obtaining fetal heart tones, you're making sure consents were signed, you're making sure the history and physicals were done, you're easing the patient's anxiety about the procedures, about getting spinal anesthesia, and you're just helping, you're running around. If anybody needs anything in the OR, you're the person that's running out of that OR and getting it. The next area I'm trained in is PACU. PACU is the place where moms go to after they have their C-section or whatever procedure they had to have. So in this area, the nurse is responsible for monitoring the patient for bleeding. Number 1 thing that the labor nurse watches out for is bleeding. These patients are at high risk for hemorrhaging. Okay, so we're monitoring their vital signs. We have telemetry leads on, and we're monitoring their heart rate, making sure that they don't go into any abnormal rhythms. And we just want to ensure the overall safety of this mom before we discharge her from PACU to postpartum. And lastly, we have antepartum, which is the high-risk maternity unit, okay? This is kind of like our mini ICU where moms go to when they have some complication. They're not turned gestation just yet, and maybe they go into preterm labor, maybe their water breaks, maybe they get a severe infection. So in this unit, it's kind of more like a med-surg unit, really. We monitor mom's vital signs, we monitor the baby, doctors order ultrasounds to see how the amniotic fluid index is, if it's low, because mom's continuously leaking amniotic fluid, does she have any vaginal bleeding? So if you have any complications, this is the unit where you go to. Honestly, I love labor and delivery because it's so versatile, it's so challenging, and no, things don't always go according to plan. It's not always the happiest place in the world, and that's where you can go ahead and make a difference as a labor nurse. You can be that person comforting your patient. You can be that person running and making sure you do everything possible to save mom's life, the baby's life. For the most part though, I have to say it's very rewarding because, you work really hard all shift, maybe for a couple of hours, maybe for your whole 12-hour shift, and at the end, your prize is that you get to see that little baby. You get to see the parents happy, that they formed, that they created this baby, and now that they're a family. So it's really special. That's what I love about it, and I would recommend it to everyone, but honestly, it's not something that everybody can do. And I just wanted to say thank you guys for watching this video. I really hope that you enjoyed it. It's been very difficult for me to film as frequently as I did before because, I'm still doing nurse practitioner school, and now I'm required to complete clinical hours, so things have gotten a little bit more tricky with my time management. I have homework to do, and it's just a lot harder. But I am really thankful that you're watching this video, and I hope you enjoyed it. And maybe one day you'll become a labor